right, good morning. Welcome back at 6:23. I'm joined with Dr. John Allen Cockrell with the Sherwood Family Medical Center, and he's here to talk about heat exhaustion.
Yeah.
Dr. Cockrell, thank you so much for being here.
Absolutely. Happy to be back.
And congrats on the new baby.
Hey, thanks so much. Yeah. Quick shout out to the family if you don't mind. I appreciate that. Sorry.
Yes,
but yeah, so we welcomed Libby, our 3-month-old now, and shout out to Ben and Ella, our other 2 kids. So took a little hiatus from the news, but so back with you guys today. So yeah, thanks for the shout out there.
Okay, so for a quick reminder, what exactly is heat exhaustion?
Yeah, so just getting into that part of it, obviously there's a huge play with heat, what it does on the body. Big difference between exhaustion though and stroke, right? So heat stroke, I think colloquially a lot of people say, I've had a heat stroke or he's had a heat stroke, right? So difference in the two. Heat exhaustion, I think we all know kind of the signs of that: muscle cramping, weakness, tiredness, usually a low heart rate actually. But you go in away from exhaustion and go to stroke level, right? That's a medical emergency, and so you're looking for symptoms there being an increased heart rate, right? Even loss of consciousness, severe throbbing headache, dizziness and confusion. Those things are significant to differentiate between exhaustion and actual stroke, which again is a medical emergency there.
And you just sort of talked about this, but can you give us any more examples of how heat exhaustion and heat strokes are different? Sure.
So, I mean, the huge defining line is going to be long-term effects, truly. So, not just in the moment, but you're looking at heat stroke, and there you see on the screen there too, the other things that can happen. But heat stroke's going to have long-lasting implications, right? So if you're suffering heat exhaustion, right, you're on the left side of that graph right there. Find a cool place, obviously. Drink lots of water, obviously, yes. But if you're at heat stroke level, again, that goes to the emergency room because there can be long-standing effects, to answer your question about possible effects from that. So I think hydration is a big key here too. And so just quickly, I know we're maybe close on time, but there's an old adage of drink 64 ounces of water a day, right? Some studies are showing that that's actually too low. So if you're not anywhere close to 64 ounces, I understand that, right? I struggle to get there some days too, but if you can increase your water intake, most adults actually can tolerate between 80 to 100 ounces of water a day.
Wow.
So that's a lot of water, but the better hydrated you are, obviously going into the summer, obviously going to have hopefully better odds to beat the heat, as it says there on the screen, to not have heat exhaustion or certainly not heat stroke.
So how good are things like Powerade and Gatorade at helping you get those electrolytes back in your body? Sure,
and I know we were just talking about this kind of off screen too. So too much of a good thing can be a bad thing, right? So not everyone has to take electrolyte replacements and those things, although they do have a place, absolutely, right? So if you're in a place where you have excessive sweating and you have heavy loss of salts and body, salts like that, absolutely, Gatorades, IV hydrations, things of that nature can be helpful. But again, not for everybody, so I don't mean to hedge there. I just know there's some difference in people and in their medical conditions, but the water is the baseline, right? Okay. That's the thing to really think about there.
All right, Dr. Cockrell, thank you so much for your time. So if you would like to contact him, you can do so by visiting Baptist-health.com or calling the Baptist Health line at 188-BAPTIST.